Hi everyone! Thanks for tuning in to my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. It's been another good week of COVID numbers. Cases, hospitalizations, and deaths are down again. The wastewater virus count in the Boston area is back to levels we have not seen since summer. We're probably entering a period of quiescence. We don't know how long it will last. We don't know if the Omicron subvariant BA.2 will affect our trajectory here in the US, and we don't know where or when the next variant will arise. Now, despite all the good news, it feels like the most divisive period in the history of the pandemic. Scientists and policymakers are not all in agreement about how much, if at all, to loosen mitigation measures. While the governors of all states with remaining mask mandates have announced plans to lift them, not all cities and towns are doing so. And while some of those states have also decided to make masks optional in schools, those discussions at the district level are getting pretty heated. I'm in favor of lifting restrictions at this time, and I think that the curves will be what the curves will be, regardless of what we do. When we look at the Omicron curves for various locales that had stricter COVID rules or no COVID rules, the curves all look pretty much the same. So I don't think we're going to throw off our downward trend just by unmasking. It's the variants that do that to us. And some have asked whether we should be following metrics to decide when to remove certain restrictions. I was a big fan of off-ramp metrics earlier in the pandemic, but today I think the data are too flawed to set good metrics, and as a population, we have a lot of immunity to the currently circulating variants. To me, that's what matters most right now. Our first question is from Ross from Delray Beach, Florida. England just announced that self-isolation is no longer a requirement, even when you test positive for COVID, clearly signaling a move toward normalcy and treating this virus like all other viruses we deal with all the time. Is this a move the US should consider making for children, teens, and healthy adults? Should we still be self-testing after every cough and sniffle? Or maybe, is it better to only test if you are at risk or have serious symptoms? Ross, I agree that the most important testing is that done by people with risk factors for severe disease. And because the treatments we have work best when given as early as possible, and the antiviral pills have to be given within 5 days of symptoms, having ready access to a test with fast turnaround time is going to be crucial for the foreseeable future, and not waiting for symptoms to get severe. As for testing for mild symptoms in people without risk factors and isolation, I'm not ready for us to give that up just yet, because I think that's when spread is really likely. But I was happy when the CDC cut isolation down from 10 days to 5 days with another 5 days of mask wearing. I think there will come a day, however, where we treat COVID like flu in every way. Test only if it will make a difference for treatment, and stay home until you feel better. What I do think we are ready to give up is quarantines after an exposure. I think those are obsolete for the following reasons. Right now, those who are up to date on vaccination are exempt from quarantines, but that doesn't make a lot of sense since the vaccine and boosters' protection against mild infection wanes over time. Contact tracing has been scaled back dramatically, so people don't necessarily know when they've been exposed. During surges like we just had with Omicron, keeping people home when their likelihood of becoming infected, depending on the nature of the exposure, is relatively low, worsens disruption of societal function. And we're no longer in a containment phase of the pandemic. The known exposed people are probably a drop in the bucket compared to all of the unknown exposed people and the people who are infected and don't know it. Our next question is from Angelica from Southborough. There seem to be wildly conflicting opinions on whether the Omicron subvariant should be a real reason for concern. Is there any new information on this that we should know about? Are there any other known variants that bear watching? Angelica, I agree. The headlines are saying one thing and then another. Here's how I interpret the data on BA2, the Omicron subvariant. There are lab studies and there are real-world studies. The scary results are from the lab studies, animal studies that suggest the subvariant might be more severe and more immune evasive. The reassuring results are from the real world. No evidence that in humans the subvariant is more severe at all. And while infection with BA2 can happen in someone who had the original BA1 version of Omicron, it's been really rare and really mild so far. Also, BA2 is not taking off here in the US so far. It's been around for weeks, and it's estimated to only be responsible for less than 4% of infections this week. Plus, in South Africa, where BA2 is now predominant, cases are really low. And no, there are no new variants of concern on the horizon. So overall, the outlook is good, but we're always watching and monitoring. Our last question comes from Rowana in Malden. Is it wise to wear an N95 mask when commuting and shopping, given that the amount and severity of COVID variants changes periodically, or are surgical masks sufficient? Rowana, that's one of the questions I can't answer for you, but here's what I will say. Our surveillance for new variants has improved dramatically, and our wastewater surveillance in Massachusetts is excellent. We will have a warning before a new increase in cases and before a new variant takes over. So I wouldn't wear an N95 just because of future variants, but an N95 is better than a surgical mask if you can tolerate it and wear it consistently. Surgical masks are good though, especially one that fits you well, or if you close the gaps with one of the techniques we talked about last week. The Massachusetts Department of Public Health now recommends mask wearing only for those who are high risk or those who frequently come in contact with someone who is. You can choose to wear a mask or not if you're not high risk. If you are though, remember we have plenty of oral and IV therapies available for you. Get tested immediately for symptoms and call your doctor if you have COVID. That's all the time we have for this week. You can send me your questions about the rollback of restrictions, COVID variants, our new normal, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.